Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
All right, let's talk about a word we hear all the time, cholesterol. What is the deal with it really? And what does it actually mean for your heart? Well, over the next few minutes, we're going to break down the science, decode those confusing numbers on your blood test, and lay out a clear plan of action. Let's dive in. We're going to start right at the end, because this is what's at stake. What you're looking at is a heart attack, and it's caused by a blockage in an artery. It's obviously a huge deal, but it's usually the final, dramatic step in a process that's been going on silently for years. Our goal today is to understand that whole process, so we can stop it in its tracks. So, where does this whole story begin? Well, it starts deep inside our arteries with a condition called atherosclerosis. It's a bit of a mouthful, but the name actually tells you a lot. Scleros is Greek for hardening, so we're going to look at exactly how our body's most important pipes can get hard and clogged up. Okay, the absolute easiest way to think about this is to picture your arteries as the superhighways of your body. They carry that vital, oxygen-rich blood everywhere it needs to go. Atherosclerosis, then, is like a slow-motion traffic jam that builds up on the walls of those highways. At first, it's just a little bit of a slowdown, but over the years, that traffic jam can turn into a total, catastrophic roadblock. What's really fascinating is how this traffic jam actually builds up. It happens in 4 main stages. It all starts with something called foam cells, which are basically the body's immune cells that have gobbled up way too much bad cholesterol. Then, more stuff starts to join the party, creating a fatty buildup. Over time, that mess grows into a complex, tough plaque, and in that final stage, the plaque hardens and makes the artery super narrow, which is what really ramps up the risk of a dangerous blood clot. In this image, wow, it just says it all, doesn't it? On the left, that's what we want to see, a clean, wide-open artery, a superhighway with zero traffic. But on the right, that's the result of that plaque buildup. The opening for blood to flow is dangerously small. This is the exact situation that can lead to a heart attack or a stroke.
Okay, so to figure out how to fight this, we have to meet the main characters in this whole drama, the different kinds of cholesterol. And here's the thing, it's not all bad. In fact, our bodies absolutely need it. The trouble really starts when things get out of balance.
So here's the deal. Cholesterol gets around your body inside these little particles called lipoproteins. Let's think of LDL as the delivery truck. Its job is to drop off cholesterol where the body needs it. But if you have way too many delivery trucks on the road, they start, leaving packages all over the highway walls, and that's what starts that plaque. HDL, on the other hand, that's the cleanup crew. Its job is to drive around, pick up all that excess cholesterol, and haul it back to the liver to be thrown out. And this diagram gives us a great visual of that whole process. You can see the LDL, the bad guy, dropping off its cargo in the body's tissues. But you also see the HDL, the good guy, working in the total opposite direction, literally pulling that extra cholesterol out of the artery walls to be removed. So you can see, the secret to a healthy heart is having a really efficient cleanup crew and not too many delivery trucks making a mess.
Okay, so this is all great science, but what does it mean for you personally? Well, it all comes down to your standard cholesterol blood test, which you might hear called a lipid panel. This is how you find out exactly what the balance between your LDL and HDL looks like.
Think of this table as your personal decoder ring for your results. For total cholesterol, you really want to be under 200. For LDL, the bad stuff, the goal is to be under 130. But now, look at HDL, the good cholesterol. This is the interesting one. Higher is actually better. You want that number to be above 60 to be considered low risk. A high HDL number means your cleanup crew is strong and it's out there actively protecting your arteries. A number below 35, well, that's a major risk factor.
Now, here is the really good news. A lot of the biggest risk factors for bad cholesterol numbers are things that we can actually change. This is a list of the modifiable risk factors. Things like smoking, what you eat, how much you move, they all have a direct impact on your cholesterol. This is where you have the power to take control.
Of course, there are some things we just can't change. Our risk does go up as we get older, gender plays a role, and if heart disease runs in your family, that's a really important piece of the puzzle. It's crucial to know about these things because they help you and your doctor understand your total risk, and that helps you decide how aggressively to tackle the things you can control.
Okay, so we know the problem, and we know the players. Now for the most important part. What do we do about it? This is all about your action plan, how to take control of those numbers and protect your heart. When you get right down to it,
It all boils down to this one simple, powerful goal. You want to lower the bad stuff, the LDL, and raise the good stuff, the HDL. Every single diet choice, every workout, it's all aimed at achieving that perfect balance, getting those delivery trucks off the road and sending in more of that amazing cleanup crew.
So how do we get it done? Well, your diet is a massive piece of the puzzle. The advice is pretty clear. Try to keep your dietary cholesterol under 200 milligrams a day. That means cutting back on saturated fats. You find those in things like red meat and full-fat dairy, and swapping them for healthier fats from things like fish and vegetable oils. And don't forget fiber. Fiber is like a secret weapon for your heart.
For instance, foods just like these leafy greens, they are packed with fiber. Adding more stuff like this to your plate isn't just a healthy meal. It's a direct investment in keeping those arteries clear.
And you know what goes great with a healthy diet? Exercise. And we're not talking about running a marathon here. The science is solid. Just 30 minutes of moderate exercise a day can make a huge difference. It helps lower that bad LDL, and just as important, it's one of the best ways we know to raise your good HDL.
Now, it's also really important to be realistic. For a lot of people, especially if high cholesterol runs in the family, diet and exercise just might not be enough to get the numbers where they need to be. And that's okay. In those cases, medications like statins can be an absolute game changer. They work by telling your liver to produce less of that bad LDL cholesterol.
So there you have it. We've seen how plaque can build up, we've met the good and the bad cholesterol, and we've laid out a game plan. The numbers on your blood test, they're not just numbers. They're a part of your health story. Understanding them is the first step. The next and most important step is deciding what you're going to do about it.